the Caffeine Coping Podcast, where real conversation fuels your mind, helps you navigate student life with more clarity, courage, and coffee. Today, we have a really interesting episode. We have the pleasure to welcome Dr. Véronique Anctil. She's a psychiatrist at Sherbrooke University. She also worked in the medical field, like in hospital as a psychiatrist. And she took the time to explain us different challenges that she observed among students in university, on campus, and different places to go very in details and widely what she observed, what she recommends. So we have a doctor just for us in the mental health field to explain us those concepts. So we're very, very glad and thank you very much again, Dr. Anctil. So I say now, so if you enjoy this episode, help us grow. It like, subscribe, leave a comment, rating on Spotify, Apple Podcasts, or YouTube. It takes 2 seconds, but it makes a real huge difference in helping other students discover these conversations, which is the main goal. So thank you very much. And let's dive in. Today we had a great discussion with Dr. Véronique Anctil. Okay, hey, welcome everyone. Today we have a special guest. I'm very, very glad to welcoming our new guest here in our podcast is Véronique Anctil. She's a psychiatrist that is working in the hospital, but also in the university. She really has a special place in the school system, and it's pretty rare to see a psychiatrist that have their 2 feet in the university and be so close to students. So I would like to thank you for showing up to our podcast, and just to let you introduce yourself to our students, if it's okay with you.
Yeah, sure. Thank you to have invited me. It's a pleasure to be here with you today. So, I have a special practice. It's pretty uncommon to work at the hospital and at the same time working in the university. I've got that idea while I was studying because I was not sure about always being at the hospital. It was a very different job. So you have less time to do psychotherapy with patients. It was different kind of diagnosis, and I like working with ADHD, anxiety, and young people. And I have a special interest in sports psychiatry too. So I was searching what kind of practice I can do, and everywhere else in Canada there is psychiatrist on site on campus at the university. So that's my mostly my practice. I work with every student, but I have a lot of athletes too.
Okay. Is it because they are more referred, the athletes, or they're more inclined to ask for help because of what they're going through, the sport, the performance, the
That's a good
academic side?
question. They have more reference since I am here, and they know, like my colleagues who are sports doctor here. Um, they do know that I am here, so they refer more. But the athletes also, those people are really invested in the recovery, and they want the best to be the most performant. So they tend to get help uh, a little easier than some others.
Okay. I would like to get back to the athletes later, but first, I'm wondering what is the current picture that you see of the mental health among our students, like here in the ones you see in general? What is like the landscape of mental health on campus? So what do you see?
So it's a good question because I have yeah, because I see people when they need help. So I see a lot of patients with problems, but I know that on campus here, at large, that it's people have good mental health. More conferences on that topic, so they have more tools than before, I think, and they are more uh, inclined.
Yeah,
to,
incline.
yes, to get help. And so I think at large it helps people. But in my office, what I see most often is trouble related to anxiety and concentration and with failure. I see a lot of person who have to deal with uh, breakup while they are doing very hard study, for example, like chemistry master, and so they have to handle all of this, and then sometimes they are foreign people, so they have to adapt to the new culture, to the university, to the language, to a lot of stuff. Sometimes they were living with their parents before, and now they have to learn to be by their own. And at the same time that the study is different at the university, it's if uh, you don't do the work, you don't get the notes. There's no
Yeah. So the pressure is important. There's a lot of competition and there's some risk factor we call. So if you come from a foreign country, you don't speak the language, you're in a tough program that they have a lot of like they expect a lot from you and not everybody get to the next level if they have to compete,
yeah,
so super
and it's
stressful. So you said something interesting. It's a cumulative stress, adding more stress. So you get into the master degree, you get in a relationship, you get a breakup, and then the
you have
chain
to
break.
perform in sports, for
Sport,
example.
yeah.
You want to be the best partner, the best sister, the best in
Mhm.
all. So, and
There's
sometimes
some.
it's not. Sorry, it's not. It doesn't have to be a foreign country. Sometimes uh, people get into the baccalaureate. They are 18. They come just from another city,
Mhm.
and it is very. You have to adjust very quickly.
Yes, I say that often here on the podcast, and I think universities especially, but here in Champlain College, it's an Anglophone college in Eastern Township, so people come from everywhere. So you're 17 years old, 18 years old, same as university. So it's the first time for some of them that get into an apartment to get to do everything by yourself. So you have a lot of stuff to learn, to adapt, and then the pressure of school, and then the midterm hits like with the stress. But I have a so what you're saying. uh, Am I wrong to say because we hear a lot the mental health crisis is getting worse? So are we just better recognizing it, talking about it, or you feel like it's getting worse? Because the main reason you say it's anxiety, concentration, like for performance, adaptation, is it getting worse, or we just have more services, getting more help for them?
That's a very good question, and I don't have like the, the scientific paper to,
Mhm.
but from my experience and clinically, what I see, I think it's both. I think what one part is uh, people talk way more about anxiety and mental health issue. For example, the Bell Let's Talk and stuff. So
Mhm.
is- and at the just at the university, I know that the professor didn't talk about that topic not often, and there are more help right now. So maybe we tend to diagnose more. But I think that with time, the definition of anxiety has changed too. And so sometimes, it's normal to feel stress. And I think sometimes it's a blurry line between what is normal stress and what is anxiety. And I think sometimes people are not living, we become less tolerant to stress. We are in a society that are really try to be positive, but it can lead somehow to a toxic positivity. And so we don't we don't tolerate stress anymore. And as soon as we are experiencing like a bad emotion, we are sometimes it's very hard to handle. And like, okay,
Mhm.
must have to be anxiety, and it's probably not normal. And so I think there's this part, but the other part is probably there is more anxiety because we also live in a society that you have to be positive, you have to be happy, you have to be, as I was
Mhm.
saying earlier, you have to be perfect. And it's like there's no limit anymore, um, as at school. And if you work while you're at school, there's no more limit with the cell phone and all the apps and the AI. It's like everywhere. So you are constantly working.
Mhm.
And, when I'm not that old, but when I was young, it's like when you have done your homework, it's done. There's no, you don't have access to a portal and to see like the constant evolution of your notes and the stats.
Yeah.
There's a lot of stats today. We have stats for everything. I mean, we feel always, we always feel evaluated, and that is a lot of pressure to handle.
It's very interesting because you're saying, like, let's say, let's go back to the sports student. They are assessed amongst their peer, they compete in competition. So in the portal of the academic space, we are always assessing, statistic, evaluating, comparing ourselves. And in terms of social media, also, like it's present. They're always comparing themselves on different application and stuff like that. So it's ongoing. But at the same time, you mentioned that we we get less tolerant about stress in general, so we're less resilient. And it's funny that you say that because I interviewed Dr. Sonia Lupien and Dr. Melissa Genereux also, and they both say the same thing. They say we need like to like Melissa Genereux was it's like we need to break an arm sometime, to adapt and get up and see it's okay to be confronted by other people ideas as well. I feel that people getting sensible also about just topics, about an assignment. Sometimes I remind students that it is normal to be stressed in midterms. Like it's overwhelming. It is overwhelming. It's a lot of preparation. You're evaluated. There's a lot going on. So the normal stress. So when when someone is when is a good moment to reach the services like more specialized about a psychiatrist? Because you mentioned like the example of a breakup. It's one of the most painful things someone can experience, losing someone you care, you love in a relationship, but they're part of life. So when there's sign that now you need to seek a little bit further, like you need to seek specialist professional help towards what you're going through.
That is a good question because I think it's never too early to see someone to get help. As soon as you are going through a rough patch, I think it's a good idea to see someone. But then who? Because there's a lot of different specialists. If I think about it here, the structure, um, there's a psychological circus. And so there's like punctual meeting. If you need help, you just feel overwhelmed. You have it's your heart feels just too heavy, so you need to talk with someone. You can go and seek help and just see someone once just to relieve all of
Yeah,
that pressure. There's also like more long-term follow-up. Um, and I don't think there's a clear. It's not clear cut when you have to seek for help.
hmm
When you're in pain, you're in pain, and it's very okay to see someone to talk about it. But when it's getting in the way of your study, you don't want to see your friends anymore. You don't have fun doing things that usually brings you fun. You don't want to do sports anymore or arts or whatever. If you play music, you just don't feel like playing music anymore. When it has an impact on all
the
the
different
other
spheres
parts,
of your life. Yeah,
I think it's a good red flag. That maybe there's something else, or maybe you need a little help to get.
Uh-huh.
If you stay in that situation for too long, you're going like with your cortisol level in your body is just going to stay high for so long that maybe it will lead to a kind of a shutdown, and then you will be- become more depressed. And once we are in a deeper depression, the deeper you are, the longer
Mhm.
it is to get out of it. So I think, and as soon as you experience like suicidal thoughts, um, I think you you need
Yeah.
help.
Yeah.
Um, Students could compare it to have a flu. Sometimes it's just a cold, you just cough a bit, you sneeze a bit, and you okay, I'm just going to see like a couple of days to see if it passes. If it doesn't pass and you get fever, which would be, for example, suicidal thoughts, now you need to consult because it maybe won't pass alone. You will need antibiotics and something. Uh, if it's if it's a flu, not a flu, but it's a pneumonia, for example, you need antibiotics. It won't pass
Mhm.
alone. So you
Yeah.
need tools. And but the good thing is that everything passes. Just like a flu, it's like a brain flu, but everything passes with the good tools, but you have to get them.
There are solutions when you get support. So what you say an interesting sentence. You say when you're in pain, and you need to seek for help. But like, I just realized, like, we didn't define what is a psychiatrist, because as a psychoeducator, sometimes some client told me, "You're my psychiatrist." No, I'm not. And I'm not a psychotherapist either. So, okay, what is the difference? Let's say between a psychologue, a psychotherapist, and a psychiatrist, for people to understand.
Yeah, but it's a very common question. I don't have the best answer yet, but first of all, the formation is very
The
different.
training.
Yeah, yeah, training is very different between the psychologist and psychiatrist. Colleges, for example, we do baccalaureate, master, PhD. We psychiatrists, you have to do like your medical school. And once you have done your med school, you have to do 5 more years of residency, and you have to do internship and in like neurology, general medicine, and all of that. Because the first thing in my job is to be sure that your psychological symptoms are not because of an organic organic disease. This is what it. For example, if you have epilepsy, sometimes it can mimic like panic attacks. And
Mm,
if you don't have panic attack, is a sort of epilepsy, or if your thyroid is you have heart problem, you might feel, or just asthma, as cause anxiety because of the medication, and because of the asthma you feel like short breath and stuff, and sometimes it can be hard to differentiate.
mm, interesting.
So this is the first part. I have to be sure that there's no underlying cause to what you feel. Then I have to diagnose in order to get the appropriate treatment. We in psychiatry, we are the ones who prescribe when needed. Because sometimes the best tool is not medication. Sometimes people do expect so much from medication, but it doesn't do all the work.
Hmm.
Sometimes it's my job to say, this is not the way to deal with what you are currently uh, living. For example, if you are living a breakup and stuff, and you're like, I would like to have ADHD pills because I have no more concentration, I'm not able to focus. It's my job to say, no, it's not ADHD. You're not able to concentrate what you live. So this is not what will help you. Maybe antidepressant, if depending on of the case, but This is the main difference. And psychologists, they are the one who see deeper, like they can see the patterns and what makes you return in your pattern and stuff.
Yeah, relationship issues, where it come from, strategies, different approach to find new ways to approach the difficulties. So it's a combination of the different approach, like you mentioned meditation, you mentioned like having a follow up, and sometimes the medication is super important as well. And there's always like stigma. It's a medication that goes, comes, and goes. Is there what would you wish students really understand better about medication in mental health treatment? So there's sometimes it's conspirationist, sometimes it's like it's just, and sometimes it happens that some doctor overprescribe, like in certain fields, certain places. We saw stories about this, but in certain cases, medication is a really good tools that to help someone. Can you explain to people or what you wish students better understand?
Yeah. I wish students could understand or could feel it's the exact same thing as glasses.
Mm,
It's like the way I can live without my glasses, but the world would be a bit blurry. So why live that way while I can have some glasses and see very clearly? It's always possible to live both ways, but why would be like, um, I don't know, like the dentist? Would you go at the dentist and they repair a cavity without anesthesia? You can. It's up to you. But now we have this science to help you not manage the pain, actually. So this is the exact same thing. It's just because we don't see it and
yeah.
we stigmatize it, but it's the exact same thing. It's just a way to manage your brain, and it's not permanent. It's not because you take antidepressant that it means that you will be depressive for the rest of your life and have pills. And it's like, it's not that. It's just a tool to help you, like the anesthesia at the dentist.
I recently heard a psychiatrist on a podcast say something very interesting. He said, because he was comparing psychiatry with different fields of specialties, and say like a surgeon will use a scalpel to cut you open to see what's going on in you, among different tools. But a psychiatrist, you will use your words to see what's in you, to understand what's going on. And I find it very interesting, like that relationship between you need to take the time to discuss the situation. How do you see that sentence, like the connection you need to do with a professional, like with a student, to really see what's going on? Because you seem to have a very large picture when you discuss stuff. Because you tell me when I have students in my office, I can see, okay, where they come. They come from another country. I have that in my evaluation. Are they adjust here in the new life? Is there something physical pain that I have a hard time understanding because of language barriers and they come from a foreign country? And that is something possible as well. Like they arrive here, they didn't have follow up sometimes. So the relationship between you and the client, how do you see that important?
It's it's a it's a basis. If there's no connection and people doesn't open up, it won't work. Because I exactly as that psychiatrist said, if you don't talk, I have no way to know. It's like if you refuse the the X-ray, how would you know that your arm is broken?
Hmm.
You don't.
Yeah.
Sometimes we we always talk. And sometimes it's not with words. So
Mm.
sometimes you can guess something or know something with the nonverbal. But if there's no connection, and I think in order to build that connection, you have to be like we have to be open. because this is the big part of my job too, to never judge people. I'm not there to judge people. I'm there to understand what's going on and what I can do to help them out. And I have to be open minded for that, because sometimes I have once I remember I had a foreign student, and he was referred to me for I don't remember, psychosis, I think. Because in his country and here, like he just gave to my colleague that note of that doctor in that country and stuff, and so they were okay. I think he's psychotic. And the more I was talking with the patient, it's just a different culture, and he was
Mhm.
having epilepsy. But the way
Mm.
he's describing the epilepsy and stuff, his family thought he was possessed by devil and stuff, because they were having no explanation. So they got on from what they know, and so they were like, okay, so you are possessed by some form of diabolic things.
Yeah.
With my colleague, he wrote that note of that doctor over there, and he listened to the patient, and the patient was convinced about that. He was like, okay, so I'm possessed by the devil.
Mhm.
So he said, okay, I'll make you see Dr. Anctil. But it was not that. It was just like a cultural difference.
Yeah.
And so
Super.
without that connection, I would have never known that. And we would have treated him like a psychotic patient.
Yeah. And it would be totally different outcomes and not really useful for the clients. Taking the time and to be aware of those cultural lenses possibly. You make it remind me of a story of someone, a woman that I follow up. She has panic attacks. She was from a foreign country. The, she was isolated, so she relies, in her family, but in her family, panic attack doesn't exist. There was something like just there's something wrong with you. You're doing it on purpose. It was not that thing where she comes from. So she seek for help and understand what is it is something that exists. But so our support network was amongst with like professional to understand that. So the education and also not to be culturally biased, to be open to discussion. I think it's super important what you're saying. So you have a lot of students from different places. You mentioned sport athletes. Um, what is the main thing you see with athletes? Is it performance, the stress to succeed, to stay? Is it sometimes obsessive? What are the challenge that you see and you recommend for someone to stay on track, healthy?
Yeah, there's a lot of challenges that they can face. But the most painful challenge of what I've seen is when the varsity sports comes to an end,
Mm. Oh yeah.
because athletes tend to identify a lot to
Mm.
to their sports. For example, I think that for a hockey player, like the number behind his back is way more important than his name.
Yeah, yeah. I have few people in mind. That's true. What you just said. I'll let you continue, but we can put emphasis on this: that the identity they have in their sports that they carry since like young age.
Yeah, and so what what remains when you don't have that support system?
Mm.
So this is a very hard challenge. It is specifically like when it comes to an end, and it's not your decision. For example, you have not been what they should
Yeah,
recruit.
chosen
I don't know, or the draft.
draft. Yeah, draft.
I think draft.
I'm not an athlete.
Um, if you have uh,
Yeah, your
in
career end.
yeah, the career end like very out of the blue, like you've had a big injury or concussion. And now it's no more football. It's your three concussion. It's game over. So it's very, very hard. Concussion is a very hard challenges for athletes too. Um, because it leads to a lot of psychological symptoms, and sometimes they feel physically okay to go back to the game, but mentally they still have struggle, and coaches don't always understand that. And this is a big challenge. And one of the other challenges I see often here is athletes with ADHD, because
Yeah.
all of their life they compensate like that hyperactivity with sports. And as soon as they don't have the same amount of sports, they tend to get hyperactive in their heads. So they have a lot of anxiety and stuff. And they don't necessarily want to treat the ADHD because they are scared that the medication will change their energy and their performance. And some of the league and federation just banned that those um those medications. So it's if you have the diagnosis, it's okay, but we have a lot of paper to do, and but they never thought that they were having ADHD because they were coping with
Mm,
sports. But once you start with sports, anxiety hits,
yeah.
and sometimes it's underlying ADHD.
That's very interesting. I never thought of it. And I have that example you say. I remember a client I followed that was that story you just mentioned, that he was involved in hockey his whole life and high level hockey, going in arena, people screaming, the crowd being there, and then injury, didn't get draft, stop, and then substance use replace the hockey, something to cope, differently. So do you see that a lot? That like that coping with strategies that are not helpful? Like how, like if you can rephrase it, how does, like, because I've been a student, like you don't sleep a lot sometimes, like you because sometimes you want to party, sometimes you just don't sleep because you're working like on assignments. You can be something isolated, and among students, we can see substance use, academic overload, different things. How do you see those things being a vulnerability or interact with mental health with our students?
That
These are large
that's
questions, but how
yeah,
do you? I'll leave you with that question.
that's a very good question. Because you were talking about like that
Substance use to cope.
yeah, this is something that I often see too, because there's a big rush of dopamine when we are athletes. What other job can you do that you get applause every day for what you do? And in real life, when we don't do sports, I don't get applause every
Yeah.
day. People screaming my name.
Every consultation. Yeah.
Exactly. So that's a big step, to just go back to normal life without that dopamine rush every day competition, every practice and stuff. Um, so this is a big deal, I think, when people stop doing their sports, and sometimes it goes not in substance. Sometimes it goes in anxiety, and sometimes it like people will. I don't know. I have one student, um, who was like, "Okay, I will try to continue being active, but I don't want to continue my sports because it's too much and stuff." And so she started running, but she started using Strava so much, and
Mm,
she so comparing herself, she started to hide some run because she was like, oh no, like the pace is not as good as my friends and stuff, and she started to become depressed about that. But it was giving her like that dopamine, like every day she tried to beat her time, but at the end of the day, she ended up with a stress fracture because she's not listening to her body.
Mm.
Because she needed so much that dopamine rush and that feeling of
Being seen now
that
as well.
that she hurt herself. This sabotage is something common in athletes at some point.
So this is, yeah, it feels like you mentioned like the hiding some runs on Strava and stuff, like being afraid to not be on top of her game or being judged, So do you feel, because when you're in college, university, the need of belonging to your peers or your sport team, or your classroom is so important, not to be alone. Can you explain to our students, like, I don't know how to phrase it, so there there's a risk of isolation, belonging is important. How to, because it's different in different college, CEGEP, there's organization, but how is it important to be aware of that isolation? It's dangerous at some point.
Yeah, it's very, very dangerous. This is a something that I often see. People try to. It's like it's adaptation capacity, uh, but sometimes people just don't want to make new friends, so they keep in touch with their old friends. But it's not the same online second, so they have no more activities. So it's a very big cliff. I don't know. It's a
Yeah,
sleeping
yeah,
cliff. I don't know how to say it. Technically, so.
yeah, yeah,
Um, because sometimes the brain is a marvelous thing, but it's also doing some opposite things sometimes. Um, for example, if you are isolated and you start to feel depressed, what will help you is to get in touch with people, do some activity, to eat well, to not drink, to um, to laugh, have fun, and stuff. But what happens when you feel depressed? You don't sleep, you don't eat, you drink, you do like exactly the opposite of what would help you, because this is what depression challenges you to do.
hmm
Mm. And so this is very important because isolation sometimes it's what leads to depressive state, and sometimes it's a symptom. Sometimes people have friends and they belong to a group, and then they start decline invitation to go to party, to do whatever. Um, Sometimes this is a sign to when you see your friend and is okay, he's tired to decline every invitation. We don't see him often. He's always tired. This is a red flag for you to recognize too if your friend is feeling bad. And this is why it's also important to belong to a group, because sometimes when you're in it, you don't even realize how far you have become depressed or anxious or in a bad situation. But the group is here to support you and to say, hey, what's going
yeah.
on?
They can
Not
raise the red flags for you.
Yeah, it's important also for that, I think.
I'll encourage students as well, like, if they feel isolated and have a hard time integrating, to reach out to their teacher as well. If they get close to their teacher, to people around, so they can have recommendation to where to go. I guess if you're from another town, you don't know what's around, you can have a little step. But it's extremely important to say again what you just mentioned. In depression, we tend to isolate, but there's a concept when we treat depression, which is behavioral activation. Like, you need to go out, and your body says, no, I don't want, I just want to sleep all the time. I don't feel like eating. But it's like, what is the little step you can do today? It's just a walk around the block, just a text message, just a call. What is the little step you can do to stay activated?
Exactly.
It's super interesting talking to you. I'm wondering, um, like recently we see a lot of trends about health, nutrition, stuff like that. Do you see an increase of eating disorders among women and men and around school? Do you see that, or is it just does not really have an impact?
That is also a good question because I have also a BA since I see a lot
Nice.
of athletes.
Oh yeah,
Um, because come every aesthetic sports, like swimming, cross country, beach volleyball, and stuff. Um, so it's hard to say if it has, but if it has done a difference. But one thing that I'm sure is that those trends can be also very like a danger. I've had recently a student who was struggling with eating disorder, and she's like, I hate the January. I hate it because of all the new resolution. I like in the algorithm of that social media. She was always seeing like the stuff about the regime and stuff and
yeah.
Weight Watchers as I
Diet, workout, do more
the
fasting.
letting company but um and so she was feeling so uh, distressed by that because of and the social media algorithm are a very big danger, like not only for the eating and nutrition.
Disorder.
um there's a lot of trends. But for the eating disorder, I this is also the comparison to other and with the AI, people will do the retouch some picture and stuff. So it's not only the trends, but the people who trick the picture and stuff. Try in our society, we try to be more inclusive and work on grossophobia. Um,
The
I don't,
which one?
grossophobie.
A body shame.
Yeah,
Yeah,
I don't know how to say.
shaming people have more weight. I don't know. I know
Yeah,
in English is glossophobia. I don't know.
I don't
People
know.
understand what we mean here.
Um, and so, but in reality, we are better now than we were, but we are better to accept it for the other. It's like, it's okay if she's overweight. It's okay. It's not a problem. But as soon as it's ourselves, it gets a struggle for a lot of people, and for the students. One thing that I noticed is that if they have a fragility to eating disorder, there's a big danger when they are living with their parents and now they live by themselves. And so there's nobody to make food and to see what they eat. And so
Yeah,
these very big challenges that I've seen with my students, that if there's nobody to see that I'm not eating, then I will not eat.
that's
Um,
very interesting. So the again isolation and because in eating disorders, there's a lot of patterns involved. It's mash. But there's different challenges. I'm wondering, well, is there's a because you say the challenge you see the most in the students is really around ADHD, anxiety, and how can you explain a little bit in details how does it work in the brain or the mechanism of one of them or something to better explain? Because I think there's a lot of misconception of what ADHD is, for example, for someone. I don't know if you're comfortable to or anxiety, which one you prefer to explain? Like how does it increase? What is it? How does it appear? To raise awareness towards our students.
I'll take ADHD. I think Sonia Lupin's the best to explain the anxiety brain thing. Um, but in ADHD, I'll try to simplify things.
Yeah, yeah, exactly.
But it's it's um it's not something that you develop. It's neurodivergence that you born with. And that specifically for ADHD, the way it works, it's in the frontal lobe of your brain. So the part behind your forehead. Um, and it's like a inverted U shape with the dopamine. So with an inverted U shape, it means that usually you try to be in the middle with the dopamine because the frontal lobe is where are the executive function. So the concentration, the ability to regulate your emotion, that regulate the impulsivity, that it's like a brake in the gas pedal. Um, and so ADHD, this is why in ADHD you have a constellation of symptoms. It's not only about the concentration. Sometimes people have hard times with work, memory, and they are impulsive. They forget some things. They have hypersensibility. They feel like mood swings. Like they are very intense. They search for dopamine, and sometimes they put themselves in trouble. Uh, but sometimes it's it's a misconception between ADHD and borderline personality.
Mm,
This is a very common thing that I see because what where I was going with the inverted U shape is that when you're under, this is why you have symptoms. But if you treat ADHD, but you don't have ADHD, um, you go on the opposite side, but it's kind of the same symptoms. So you can feel anxious, you can have hard times to be concentrating and stuff. So it can be dangerous to take medication or prescribed or not, because a lot of people take speed also
mhm,
and other drugs, stimulants. Um, And so this is dangerous because you will feel not concentrate. And then what happens is that people will say, oh, okay, it's because the dosage is not high enough. And the, the level up the dosage, but the problem is it's already too high. So you have to go back. Um, and sometimes if no medication do works for the ADHD, sometimes it's because of the constant, it's the same with the depression. You can feel depressed. It's not necessarily a depression.
mhm.
Have bad news. You can have hypothyroidism, or you can have a lot of things. It's the same with focus. You can lack of focus because of ADHD. But if you are anxious, you are constantly thinking
Yeah.
about what can happen, and you imagine bad scenarios. So you're not able to learn new things, and you have trouble to concentrate, and it takes longer to read and stuff. If you are depressed, it can affect concentration. And if you have a borderline personality, you have those mood swings. You have that impulsivity. You put yourself in trouble often, but it's not ADHD.
Mhm. It's something different. It's a neurodivergence that you said. And
Yeah.
also concentration can be different during one day, can be trained also with social media scrolling, your attention change through times as well, and your anxiety rise. This can change a lot of things. I feel like it's so difficult to assess the ADHD because recently we hear like, okay, sometimes a certain sign of autism can feel like ADHD, but it's not ADHD. But the hypersensibility is there in different diagnoses, but and it's the expression is different in women and men sometimes, and how it might be tough to be in your chair sometimes to really assess what's going on with your clients, with your patients.
Yes, and sometimes, and I love my colleagues in neuropsychologists. They are the ones who do like the
Test,
IQ test and
yeah.
stuff. But sometimes, and it's the same for everybody. When you only work with ADHD, you have that biais because
Hmm.
the only thing that you see, and so you are very good at saying if there is some difficulty, but the underlying cause sometimes is not ADHD. And once students get that diagnosis, it's very hard to reverse that. And sometimes it's the wrong diagnosis, and it's not because they did a bad job or something. Sometimes the evaluation is just not considering like um, uh, some other aspects that it's a teamwork.
Yeah, it's a
So
teamwork.
so and sometimes people don't they're not always honest. Sometimes they take drugs and they want to clear, so they don't say that to the neuropsychologist. So
Hmm.
that can change the result
Yes, yes.
um, a lot.
I
And
I had clients that did that. That they lie their way in, and they start taking prescription that wasn't belonging to them, and then they stop it, and then they change for amphetamines just to get like and can be a dangerous path.
yeah, and when there's a neurodivergence, like I'm not the one who answers that, for the autism and stuff, because it takes a very specific test. Um, but and there is this new that it's not a diagnosis in that it's not a pathological thing, but the HP or douance is
Yeah,
a common thing recently with ADHD and stuff, and so people get confused. And the way I see it, and I try to explain to my students, is to know the the part of our job is not to pinpoint exactly. So sometimes it's that, like the same way um emergency doctor work. Sometimes we don't know exactly what you have, but we know what you don't have.
hmm,
This is what's important. And so it's the same, the brain and psychiatry, like the diagnosis can change over time. But what matters the most is no matter if you have ADHD or not, if you have autism or not, is in what way does it affect your life? In what way it causes you distress, and what we can do. The point is just to get to know yourself and to know how it works and to work on those problems independently of the underlying diagnosis, is to work on the challenges that matter the most, because the diagnosis is helping tools to treat people, but not a man.
that's awesome hearing a psychiatrist saying that. Like you just put out the stigma and say, hey, we don't really. We can put the sticker, the stamp that okay, you have this thing that recommend that treatment, but the expression, all of those things, depend on who you are, where you come from, how you communicate, doesn't change who you are. It's not an identity. The a mental health diagnosis or whatever is that doesn't define you. Sometimes we observe people when you get a diagnosis, they're like, "Oh, I am ADHD." Yeah, ADHD is part of your experience, maybe, but you're more than that. You're more than bipolar. You're more than like I had a teenager was following he has a psychotic episode following substance use. Like like I'm schizophrenic. Like you're way more than that. It's a part of your experience. Sometimes it takes more space. Sometimes it takes less space, but you still. that person with that interest, with that group of friends, with that skill, that strength, that challenges. So it's way more than that, and how it's expressed in your life. So it's very interesting the way you put it out, that how does it affect you today, and what can you do
Yeah,
about it? You know?
absolutely. Like mental health is not an identity.
Yeah. Yeah, you won't say that if you have like a broken arm. Like I'm someone with a broken arm, you know. It's like yeah, yeah, my arm is broken, but I'm still me, you know.
Exactly. I love a comparison.
So if I will end with an like unless there's something specific you really want to mention, I want to end with a large question. Like if you go back when you were 20, if you were 20 years old today, going back in school, you know, what would you do? What would you recommend to your 20-year-old self, like today? Like you, someone that is starting is in school system, getting out of the town, going to college, adapting, starting that new, like the new step of life. You know, what are will be your main recommendations for someone that age to be aware?
My recommendation is it's okay to fail. It's okay if you are not able to handle all of that pressure. It's okay to change, for example, your sports from competitive and go more in a recreative way. It's okay to not succeed. It's not an end. Uh, I've I've experienced some failure too, you know, and then high school, I've got like 40% in mathematics in secondary four. I was like, "Oh, okay, there's no way I can be a doctor one day." But there's so much pressure today. Of if you fail one exam, it's like the end of your life, and you'll never do something good and stuff. And it's okay to fail, and also it's okay not being okay.
Hmm.
And you don't have to pretend to be okay. You're just going to miss an opportunity to get help and to grow and to go where you want to go. It's okay to take the time not to be okay.
Take the time. It's okay to fail. It's okay to not be okay, and take the time. It's not the end. It's a progress.
Yeah, sometimes it's like we have to stop in order to go further.
Mhm.
I think about like Samuel Montambo. Here, he has very hard time at the beginning of the season, and it was a lot of pressure. But you know what? He just put his ego aside. He accepted to go back with the Rocket to practice more. He loses some game with the Rockets. I cannot imagine how hard it must have been. But
Mhm.
he gets back with the Canadians and he wins some games
Yeah.
because he was able to put his ego aside and say, okay, I need help. Those are the professionals. They say I have to go with the Rockets. So here I go, and I have to take a step back to go further to improve my name. And so I think this concept is the same with everything in life, not only in sports, but with the studies. Sometimes it's okay to take a session off, to take care of yourself, to stop feeling bad and to really take the time if you want to continue, and it's okay.
And I would like to say to our students, because we have a lot of students that are the first generation of their family going to college, that it's okay if your family doesn't understand you, your situation, that you can still create a sense of belonging there, you know, in college.
Absolutely.
Yeah.
Absolutely. You belong wherever you want to belong. It's up to you, not to nobody else. It's your life.
Yeah. Thank you so much, Dr. Anctil.
You're so welcome. It's a pleasure.
Thank you so very much for this conversation. I really appreciate you taking the time to speak with our students, and I'm sure this will resonate with them. It's awesome. Thank you very much, and have a nice day.
Thanks, you too.